Gauteng, one of the COVID hotspots in the country, the pandemic has caused a spike in the demand for reliable ambulance services, especially for the most vulnerable who do not have medical aid. The matter is now attracting political attention.
Gauteng's emergency ambulance service is in crisis, but I don't think that the provincial government wants to admit this.
Gauteng's population is 15.8 million people. The province has 3 big metros with large remote towns and some far-flung villages. The provincialization of the emergency ambulances led to the withdrawal of ambulances in 2 of the 3 metros. But after disagreements between the province and emergency services, the process has not been smooth sailing.
As you know, that Gauteng was in the process of provincialization, especially the metros. They did not transfer their staff and their fleet to the province. So we had to work and cover the areas that were covered by the metros with our limited resources.
Tshwane is the only metro with an operating license, but it's temporary and expires in December.
But we are operating under a temporary license that was issued by the Gauteng Department of Health, and that license is valid until the early December. We are waiting for that approval. There had been issues between ourselves and the department, but obviously I cannot preempt the outcome, from the as to our application. It's already more than a year that the process is being ongoing, and obviously there are issues at play.
Tshwane has a population of 3.3 million people. The metro only has 73 ambulances.
In an emergency, no resources are ever enough, because one doesn't time an emergency as to when it occurs. It is ideal that we would have more resources, and at this stage, 73 is doing the work, but given statistically as well as the requirements in terms of population versus resources, you wouldn't say that it is enough. One would say that you have to do the best with what you have.
After many complaints of unreliable ambulance services in Johannesburg, the province will resume talks with emergency services.
In Tshwane, we are no longer receiving a number of complaints. Then Johannesburg did apply, and they withdrawn their request to be granted a temporary license. And then Ekurhuleni never requested a license. But what we have done, we have said we will follow up with Johannesburg so that we can be able to make sure that we are, because they are sitting with the resources.
The DA's health leader in the province says people's human rights must be respected.
They give figures for priority 1 emergency calls that are responded to within half an hour, and they say that they are doing a good service, but people on the ground don't believe it. I get countless stories of people who've called ambulances that don't arrive.
COPE called for urgent resolutions on the matter.
We are faced with a very dangerous enemy called COVID-19. It is totally unacceptable that people are dying waiting for hours to get into an ambulance. Premier David Makhura and his provincial government must take full responsibility for the crisis in the ambulance services.
Before the provincialization, all 3 provinces provided ambulance services with their own resources. The province served as an additional service. The DA and COPE called for a review of the provincialization of ambulances. They say this will help to provide a reliable and dignified service